Hi guys, welcome back to my channel. My name is Jacqueline and I'm here with my very amazing surgeon, Dr. Beck.
Hi everybody, welcome back again. We're here to talk about the next step for Jacqueline and in her reconstruction and in skin removal surgery.
So we're here finalizing the next surgery, which I've been most excited about, I think, for a long time. And we're gonna start the process on removing the skin from my legs. So he's gonna kind of explain more what he's gonna actually do and all that, and where the incision's gonna be, and just kind of explain everything to you guys of what's next. So
what we did in anticipation for this procedure in the past is that because of Jacqueline's fuller thighs and legs, we debulked that area by doing liposuction to make it thinner and to make the skin looser. So now you can see that her skin is much looser. And it actually goes all the way down into her calf. So the plan for this operation will be to make marks on her thigh, and it's going to be where it starts up in the groin region and it comes down almost like a big V on both sides, and it's going to come all the way down. We'll try to go even into the calf some, and then we're going to take that skin, that area where in between the marks, and we're going to liposuction that to make it easier for everything to close. So the V part will then close in a horizontal fashion. There will not be any big heavy lifting this way. It's all going to be more this way. And the reason for that is if you try to do a medial thigh lift in different directions leading up like this, as well as the vertical, horizontal, the weight of the skin will be so much that this area can break down. So that's our next step for the operation. I think one of the things that we did in preparation also for this procedure is Jacqueline went to get an ultrasound of her, the deep veins in her leg, to make sure that the deep veins in her leg were patent, which means open, and that everything was functioning properly, since we're going to be changing the way the lymphatics flows and the blood flows from the skin removal operation. And everything was really good with that. So now we have a clear, we have thumbs up from the deep venous study, the Doppler ultrasound study, and we are ready to proceed.
So for the scar, where is it going to be? A scar starting here and then going this way?
Yeah, I think that the way that the scar is going to be is it's going to be up in the groin, and it's going to come all the way down. And if we can mobilize some of this, we'll try to even pass the knee joint area into that region. So she'll have a scar that comes all the way down. And then after the surgery, we'll have a drain on each leg, each lower extremity, and we're going to wrap her leg up with ACE bandages starting at her foot and leading all the way up to her pelvis. And then the positioning for this will be, she will be lying down on her back, and then you have one of those angled foam
like a pillow.
It's a triangulated pillow you could get like at a medical supply location. So her feet are elevated relative to the rest of her body so that all the blood flows back towards her heart, and it helps with decreasing the swelling in her legs and in her feet. Yeah.
So recovery-wise, about how long is recovery for something like this?
How long was the recovery for the liposuction? To your lower extremities?
Like 6 weeks?
6 weeks?
I think so.
So 6 weeks was the recovery, and what do you actually mean by recovery?
For like the pain to really be gone and I could really do my normal activities more so.
Okay, all right.
But I don't know, like recovery, like...
I suspect it's going to be very similar.
Yeah.
Very similar. The thing we worry about the most for a medial thigh lift or medial skin removal is infection, because there's lots of bacteria around the private parts, and so the upper part closer to the groin needs to be meticulously cared for, and that's going to include keeping the area dry, keeping towels between the thighs to try to keep everything dry, the use of oral antibiotics for a period of time. So I think that's the one thing that we're concerned about more than anything else. And once we can get you through that, then the rest of the incisions I think will be okay. I think as far as how far we go down, we don't know exactly how far we're going to go down, because this still needs to be kind of debulked more. And also imagine if you're making a calf muscle just by walking and the muscle enlarges a little bit, that can place wear and tear on the closure. And we don't really want that to happen. So, you know, as I've always mentioned previously, this is comprised of some big procedures, and it's also comprised of some touch-ups that we may need to do down the line, even in our minor procedure room. But this is the next big operation. So far we've had the corset trunkplasty, we've done an upper body lift, we've done liposuction down into her thighs and in her legs.
My arms.
We did your arms. And so so it's a long haul, but Jacqueline's been just spectacular. Great at preparing, going through it, and then post-operatively bouncing back. It's pretty amazing.
And I think that's why I talk to you guys all the time about making sure you find a surgeon you trust, because it's not just one surgery and you're done in most cases. You're going to be together for a long time doing a lot of intense procedures, and you definitely want to find someone who's certified but that you trust and have a connection with, to know that they're going to take care of you and do the best that they possibly can. I talked to Dr. Beck that I really wanted to do my calves, but I also really trust him to know that he's going to do the best he can, and that he's going to take care of me and not harm me and do anything like that, because I keep telling him to do my calves. So I know he's not going to listen to me all the way, because he's taking care of me and doing what's best for me, which is ultimately what you want. So that's why it's very important when you're picking your surgeon to have that connection where you can talk to them, but that trust that you know that they're going to do what's best for you. So.
I think the other thing that we are doing, you have been doing, is that you've also been taking iron, getting ready for this procedure. So, you know, Jacqueline's healthy, she's young, she already has a good hematocrit and levels, but just to try to build up a little bit more of hematocrit, or the amount of blood in her system, we're trying to initiate more using iron. So we're starting with iron supplementation. Actually, you've been on it for a while now, haven't you? So I think that's important. I think that preparing your home, the way you're going to position yourself on the bed, and have a realistic way of how you're going to be able to do the activities you need to do on a daily basis. And Jacqueline has an amazing fiance, Kevin, who's been just spectacular. So I think you're very lucky, and I know Kevin is as well. So,
So pain-wise, how's pain for something like this do you expect? Worse than
the liposuction?
Or like stomach or arms, or less than? Or I know people were asking about walking, how you walk. You kind of just walk.
Yeah, I think that ambulating after a surgery like this is going to be dependent on how swollen you are. You know, I think you're going to have to figure out the best way to ambulate. I can't answer that question right now. As far as the pain, I don't necessarily think it's going to be any worse than what you had done to your abdomen or your arms. I think you're pretty stoic, so you can get through it. You're motivated, so I don't think you're going to be in excruciating pain.
No. Yeah. I think too, when you go through these things, you have to be mentally ready to go through them as well, because that definitely helps recovery. Like going into surgery, making sure everything's ready, like you said, but being positive and knowing, okay, this might suck for a little bit, but it's not gonna be like this forever. And you're gonna be able to get through it. And then the results after are gonna be more than worth it. So it might be hard for like a little bit, but it's worth it in the end, so.
Yeah, visualizing where you're going to be after all this is done.
Yeah, exactly. So I hope you guys enjoyed this video. I hope you found it helpful in knowing my next steps, the next steps that we're taking together in this whole journey. Thank you, Dr. Beck, for filming this with me and going through all these surgeries with me.
Yes.
And thank you all of you guys for your support and love. And if you ever have any questions or video suggestions that you'd want us to film, make sure you let me know. Make sure you go check Dr. Beck out.
Sounds good.
Right?
All right.
Thank you so much for watching.
Thank you, guys. Thank you.
Bye.